Our residents in Gauteng are being warned not to prank call health hotlines. Gauteng's health department says it receives a high number of hoax calls on its emergency service lines over the festive season, where the department was briefing the media today on its festive season safety campaign.
Season is upon us with mere hours before the first public holiday begins, and Gauteng is one of the provinces which sees a high volume of traffic leaving the province, but also entering the province as many holidaymakers begin the end of the year celebrations. We're here with the Gauteng Health Department as they briefed us on the readiness of the healthcare services when it comes to the festive season. There is usually a higher volume of trauma cases that do happen during this time, given more people out on the road, but also with the festivities that we see happening, many end up enjoying and sometimes indulging a little more, which leads to some reckless behavior. I want to bring in the MEC to explain to us just what are some of the plans that are into place, to ensure that holiday makers that are in Gauteng, that are staying behind, but also coming into the province, have a safe holiday and festive season here in the province.
Indeed, we have plans. Even today, you are pulling myself out of a meeting that I'm having, CEOs that are giving me the latest plans now, because every day for us, we must start evaluating the work that we'll be doing in this festive season. People are going home starting from today, by the way. So in all the regions, we are putting up our teams that will be working 24/7, especially the ambulances. The team at the forensic pathology will be available. The clinical TDG has indicated the plans that we're having on the clinical side, because all our hospitals and our 24 community health centers will be opening, so that any eventuality that happens, we are there on time. Any disaster that happens, we have learned even last year on the 24th of December. Remember, everybody was on holiday, but the team in the Department of Health was around, so we're able to immediately attack that. So we have systems in place. I think now we're able to deal with disasters in the province. We have learned a lot. So our command systems, we always activate them when there are busy times like this one.
What is your message to the holidaymakers? Some of the concerns and warnings to ensure that reckless behavior doesn't become a norm, and that everyone is safe out of the hospitals during the holidays.
You are correct. Reckless behavior is one of the major things that create us to end up having a lot of people that are flocking in the hospital. People must buckle up when they get into their cars. They must not drink and drive. But another thing, when it comes to other diseases that in the province we usually have, we have your people that will be getting out of the province, coming again, bringing your diseases like malaria, cholera. But we are saying, wash your hands, stick to the issues that you do for health, of washing your hands thoroughly, make sure that you use soap, make sure that you avoid anything. Don't drink and drive. It's one of those critical things that we're emphasizing. Don't send children to buy liquor for you, especially the uncles. They always send them, we find them with big bottles of beers that they are sent by the uncles. So let's avoid anything that will be a temptation to end up people getting into hospital.
You've mentioned that the command center is up and running and ready for any kind of disasters. But you also mentioned that the emergency services during this time find themselves finding a lot of prank calls that are happening. Can you just explain to us, what is that phenomena, but also warning how that impacts services, when people make these false calls?
Those false calls impact services because our team, EMS team, is scared of getting out, especially when they come now, because they know that they may be marked, they can take that ambulance, and there are a lot of incidents. Almost every month we find a lot of incidents of our EMS guys that are picking up that are marked. But there are measures in place that are doing again. We're working now with other security companies, including SABC. We have a panic button now that we're going to install in all of our teams, so that when they go out, at least there's that panic button. And the command center, they will be known that the ambulance is going to a specific community. There are these calls, but everybody will be alerted so that they are able to follow them if there's any incident that harms. It's one of the things that we're saying. Make sure that your children are not doing those prank calls, because most cases it's children sometimes that will do the prank calls, but sometimes it's criminals themselves, because in our ambulances we have these machines that they want so that they can go and sell them. That's another problem that we're experiencing as the Department of Emergency emergency services in the province.
Thank you so much. That was the MEC of Gauteng Health speaking to us here just on the state of readiness of the department for the festive season as we go into the December festivities. Tomorrow, the first public holiday begins, and then from then on, many in that holiday mood, ensuring that any holiday makers that are coming into the province as well as leaving do so in a safe environment, but also ensuring that should there be any accidents or trauma that may need the health system to be activated, that they are ready and waiting. That's it for me for now. Back to you in studio.